In this video, we'll discuss about the good sleep hygiene to improve insomnia. So we'll begin with the introduction of insomnia. Insomnia is the complaint of poor sleep and usually presents as a difficulty initiating or maintaining sleep. People with insomnia are usually dissatisfied with their sleep quality and feel that it impairs their ability to function well in work, school, and social situations. Affected individuals also experience fatigue, decreased mood, irritability, malaise, and cognitive impairment. This is the reason why we need to treat insomnia. So the treatment of the insomnia basically improves the quality of life and can promote long-term health of the patients. Improved sleep also decreases the daytime fatigue and improves the cognitive abilities. And the methods of the treatment can be broadly divided into various groups. The methods of treatment include establish good sleep hygiene. So this is the aspect which we will be discussing in this video. The other modalities of the treatment include treating the underlying medical disorders, using behavioral therapies for anxiety, and using negative conditioning in some cases. Similarly, use of psychotherapy for treating the underlying psychiatric disorders, which are one of the common causes of insomnia. And next modality is the use of the pharmacotherapy when no other treatment modalities are working for the treatment of the insomnia. But we'll be focusing on the establishment of the good sleep hygiene to improve the insomnia. So to attain the good sleep hygiene, we need to have good habits. Our behaviors will decide the hygiene we are going to have. So there are helpful behaviors which will help you to attain a good sleep hygiene, and there are the behaviors which we need to avoid so that sleep hygiene can be maintained. So the helpful behaviors include using the bed only for sleep and sex. So the bed should be only used for sleep and sex. And if you cannot sleep within 20 minutes, you need to get out of the bed and read or do some other relaxing activities in dim light before returning to the bed. This will help in maintaining a good sleep hygiene and getting proper sleep. Next important behavior is making quality sleep a priority. For that, you need to go to the bed and get up at the same time of each day, so that your body will get used to that routine and it will help you to attain a proper sleep. In addition to going to the bed at a predefined time or a fixed time, you also need to ensure a restful environment in your bedroom. Like your bed should be comfortable, room should be quiet and dark. This will help to improve the quality of the sleep. Next important helpful behavior is developing a consistent bedtime routine. You should always prepare for sleep within 20 to 30 minutes of relaxation. You can prepare for sleep by using the soft music, or you can do meditations, yoga, and you can even read some pleasant things. You can take a warm bath. These all things will prepare you to become relaxed and help you get a proper sleep. Now we'll be talking about the behaviors which you need to avoid to attain a proper sleep pattern and to improve your insomnia. So you should avoid the behavior that interfere with the sleep physiology, like napping, especially after 3 p.m. in the evening, like attempting to go sleep too early, and taking caffeine after the lunchtime. These behaviors will alter the sleep physiology and can contribute to the insomnia. So all these things should be avoided for the proper sleep or the sound sleep. In addition to the behaviors mentioned before, in the 2 to 3 hours before the bedtime, everyone should avoid heavy eating, smoking, or drinking alcohol or doing vigorous activities. these things are associated with a poor quality of the sleep, so they need to be strictly avoided. And next important behavior to avoid is solving problems while trying to fall asleep, or thinking about the life issues, or reviewing the events of the day while trying to sleep. All these things will reduce the quality of the sleep, and it will make it difficult to initiate the sleep or maintain the sleep. So all these behaviors should be avoided. In addition to the above points, there are some additional points to note. The bedroom should be off limits to computer, televisions, radios, smartphones, video games, and tablets. If e-reader is used, light should be adjusted for evening use. It should be dimmer or reduced blue light if possible, because the light itself, especially in the blue spectrum, it suppresses melatonin secretion and is arousing. So if you follow these behaviors and avoid the behaviors which are mentioned in the presentation, you can attain a good sleep and you can improve the insomnia. So all the contents were taken from this book. You can go there and read in detail about the insomnia and the other modalities of the treatment. So thank you for watching. Subscribe for more videos.